Over 1,000 registered nurses and allied health professionals gathered in Toronto last November for the 2014 Biennial Convention. The theme, I'm In, Stronger Together, signified the strengthening of the country's largest nurses' union and the organization's commitment to engaging its membership. ONA members attended a giant rally at Queen's Park, organized by the Ontario Health Coalition. The Government of Ontario is forging ahead with the most aggressive plan ever to systematically strip local community hospitals of services and cut or privatize them. They are already closing down outpatient services, physiotherapy, labs, pain clinics, fertility clinics, and more. Private clinics are proposed to fill the resulting vacuum.
What's happening in our hospitals is unacceptable. We cannot stand by and watch the continued loss of services out of our hospitals into private clinics. I'm thrilled that you're here today, but I want to send one message back with you. When you go home today, talk to one person. Talk to someone in your family, your community, or at your workplace. Tell them that we are losing our healthcare system and we have to fight for it. Ask them to speak to one person. This fight, and it is a fight, is going to come from the ground, and it's going to come from each one of you doing your part back at the ranch.
Premier Kathleen Wynne, our hospitals will not survive the cuts that you are planning. Whether on purpose or by neglect, what you are planning is nothing less than the death of the community hospital in Ontario, and we will not stand for it any longer. We will win this. Thank you for coming.
ONA continues in a state of readiness on the issue of the Ebola virus, closely monitoring government alerts, providing background information for members, and a special web page on the ONA website. ONA is hosting a new video on Ebola produced by the Canadian Federation of Nurses Unions.
The Ebola virus disease may no longer capture the front page, but all it takes is one infected passenger to land in Canada.
Bill C-377 has reared its head again as the Canadian Senate prepares to reintroduce this attack on unions and other organizations. ONA is asking members to petition the Senate. In December, registered nurses and healthcare workers from Temiskaming Hospital protested management's plan to cut 15 jobs, including 6 full-time registered nurses. This represents a loss of 11,700 hours of RN care per year. The last few months have seen a very disturbing number of physical assaults on nurses. There were 36 violent attacks at London Health Sciences Centre just in the first few weeks of January, leaving nurses with head injuries and broken bones. The Centre for Addiction and Mental Health had 2 violent attacks on nurses in early January. CAMH in 2014 saw a 29% increase in violent assaults. Southlake Regional Health Centre also had an assault against a nurse in December. ONA is demanding that management and government take action to protect nurses, stating also that underfunding contributes to workplace violence. On January 30th, 3,000 ONA members from 9 community care access centres began a spirited, unified strike against their intractable employers. These health professionals include care coordinators, direct care nurse practitioners, rapid response registered nurses, registered practical nurses, respiratory therapists, occupational therapists, speech therapists, and social workers.
The employer walked away from the bargaining table. Our collective agreement expired March 31st of 2014. We've been trying to negotiate with a group of employers that have had a hired consultant in that is basically trying to shove a lowball deal down the throats of 3,000 healthcare professionals, and they're not going to take it.
The ongoing labor dispute will now be sent to arbitration. The ONA RNs and allied professionals are again providing health care to their patients and await the arbitration process. 3,000 registered nurses, registered practical nurses, and allied health professionals working in Ontario nursing homes have a new 2-year agreement that provides them with wage increases in both years. Another group of ONA members may be mounting picket lines of their own. 32 public health nurses and registered nurses at the Peterborough County City Health Unit have voted in favor of strike action. They could walk out on March 13th. After accepting a 2-year wage freeze, the nurses are looking for a fair wage increase comparable to Ontario's 57,000 hospital, long-term care, and other public health nurses. ONA will give them full support to ensure their success. While many pension plans struggle with underfunding, the Healthcare of Ontario Pension Plan, HOOP, which is Ontario's third largest pension fund, has $1.15 on hand for every $1 it must spend. Stocks in the Toronto market returned 7.4% on average in 2014, while HOOP returned a record 17.71%. The plan's average return in each of the last 10 years is 10.27%. HOOP announced their 2014 results in March, and ONA members are in good shape.
We can meet all of our current and future pension obligations for nurses, so they can sleep well knowing their pension is secure and in good hands.